What is the negativity about mammogram?
They feel it involves X-rays and mammogram is painful. These are the two most common myths about mammogram.
Is it painful?
No, the women can feel a slight discomfort because the breast is slightly compressed between these two plates. It can be a little painful. Discomfort will be there, but it is not painful. Yeah. Also, if they feel pain, they can schedule the mammogram in their first 10 days of their menstrual cycle so that the pain will be a lot lesser. And about X-rays, the mammogram involves very minimal dose of radiation, which is almost equivalent to 7 weeks of our background radiation. So that is nothing when compared to the benefits of mammograms.
Say that again one more time. It's equal to 7 weeks of?
Our background radiation.
Background radiation.
Environmental radiation we'll have, no sir. So it is equivalent to 7 weeks of background radiation.
Okay. Tell me more. Environmental radiation is like a normal person
exposed normal person
to radiation.
Living in your they're exposed to.
So it is nothing basically. Yeah. It's almost similar to any other X-ray.
Yeah, even CT will have much higher radiation than mammogram.
Right. So an MRI doesn't have any radiation at all.
Yeah.
So that is something that we need to emphasize. But MRI is expensive.
And we cannot do MRI for all the patients, and MRI cannot detect microcalcifications.
So just because you can afford MRI, that might not be the right test anyways.
Yeah. The first step is to do the mammogram. If there is anything abnormal, or you're very young where mammogram will not work, you can go for MRI.
So a person listening to this podcast, if she is 40 years old, she should start getting mammogram right away once a year. Is it covered by insurance in India? No.
It has to come out of their pocket.
Out of the pocket. Okay. So in the US, it is covered.
Yeah.
In the US covered.
Also, there are screening programs in US, structured screening programs where every woman is screened when they have insurance. But it is not the case in India. Women has to come out of their own interest to get the screening done. So only less than 10% of eligible women are undergoing mammograms in India.
Only less than 10%? That's a lot less.
Yeah.
Wow. What is one situation that you saw a patient and then you wished that this patient have come earlier?
So as I said, the painful lump myth. So they'll think that it will be normal. So or what they think is like, there is a small lump, but it is not causing me any trouble. It is not hurting me. Why to get it checked and get a diagnosis? And also people fear a lot about chemotherapy where there is hair loss. So that is a major, once I tell that the diagnosis is this, the breast cancer, like it's you have breast cancer, the first question they'll ask me is whether I'll need chemotherapy. So they're like, there is a lot of stigma around breast cancer. People want the neighbors to not to know about their diagnosis. Even if they get treated, that is fine. But their appearance and others knowing about the diagnosis, that is a lot more actually.
Because chemotherapy can cause hair loss.
Yeah.
And that will be visible.
Yeah.
And people will start asking, what is that what you're talking about?
Yeah.
Wow. So let's say that, a patient forgot to do a mammogram, did not come when there is a painless lump, and then comes at an advanced stage, and then you have diagnosed them with breast cancer. Treatment is always chemotherapy?
No, actually we use multimodality treatment. Depends on the stage of the tumor and how aggressive the tumor is. The treatment varies. If the patient has come in an early stage, the first step is always do the surgery. Like without any lymph nodes, only small lump in the breast. The first step is to do the surgery. Most of the time it will be for early stage cancers, breast conserving surgery. That means only the cancerous area is removed. The rest of not the whole breast is removed.
It's called lumpectomy.
Yeah, lumpectomy.
Where there's a lump, you just remove the lump alone.
Yeah.
You look under the microscope and make sure that the margins of that tissue
actually if the lump is palpable, they can take adequate margins during the surgery itself, and they'll also make sure with pathology whether the margins are clear.
Correct. And the pathology, look at the microscope and then say that, hey, there is some cancerous tissue in the middle, but outside margins are free, so you don't have to do anything further. And that is why early detection is important. Am I right?
Yeah.
Okay.
Also, this breast lumpectomy always followed by radiotherapy.
Is it right?
Yes. Because when you remove the lump, you want to make sure that it doesn't come back in the same breast again. So radiotherapy is given to that breast, like when the breast conserving surgery is done.
Can you educate the audience about what is radiotherapy?
Radiotherapy is the treatment involving X-rays to reduce the risk of recurrence after breast cancer treatment.
So what does the X-ray do?
The X-rays kills the cancer cells, microscopic cancer cells, if at all they are there left after surgery. So this prevents recurrence of the cancer in the same area.
Okay.
And chemotherapy, whatever, if the invasive cancer, generally they have to undergo chemotherapy, except for few non-aggressive tumors in an older age women where they can avoid chemotherapy if they are in stage 1. So most of the women will have to undergo chemotherapy, and the aim of chemotherapy is to reduce the risk of recurrence in rest of the body. So the microscopic cancer cells might have settled somewhere else, which was not visible during initial evaluation. Like when we do PET scan, if it is of significant size only, we are going to identify. The cell level, we won't be able to identify. So to cure those cancer cells, chemotherapy is given. So as we give chemotherapy, it affects the normal tissues also. That is why the hair loss and all is there, but it is totally temporary. It is for few months only. Once we stop chemotherapy, the hair cells start growing like a lot denser than how it was previously.
Oh, is it right? Yeah. How long is the chemotherapy for usually on average?
For 3 months, 3 to 4
3 months. That's it. And then
so it is totally temporary.
Temporary. Wow. It is still a debatable topic about hormone replacement therapy in that particular age.
Even oral contraceptive pills, if they take for a long term estrogen containing thing, that is a risk factor for breast cancer.
Birth control pills has estrogen in it.
Yeah.
And if you've been taking it for more than 10 years, 20 years, that increases your risk a little bit because of the unopposed estrogen again. Yeah. Wow. But multiple pregnancies, multiple deliveries decreases the risk, correct?
Yeah.
Because of the...
multiple pregnancies and breastfeeding reduces the risk of breast cancer.
Breast cancer. Wow. So we talked a lot about breast cancer, and I'm hoping that a person listening to this podcast will start mammogram once a year, starting from age 40. Start doing self-breast examination starting from age 20 within the first week of your menstrual period every month. And then if you notice, don't wait for until it becomes bigger. Even if it is painless, please go and check and don't get panicked because most of them are benign.
Exactly.
Super. Wonderful.